We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
So we have had Sue Vento. Yes.
Do you happen to have a list of the Democrats who are supporting that bad Hillary Clinton bill?
I can get them to you in just a moment. I just need to pull it up. Great.
Thank you. Great question. So these questions can be directed to anyone who's sitting here on the stage, but also any of the panelists that we had after lunch.
Hi. Yes, note the short question. I'll try and be better than last time. This is a very straightforward question. Does anybody in this room have any information about any medical evidence that says that young lungs are more susceptible to asbestos penetration to the pleura than older lungs? In the UK, we've had quite a big blarney about this. We have proved that young people are more likely, young people exposed at, say, 10, are much more likely to develop mesothelioma because they've still got plenty of time to do so, whereas a 50-year-old will die of something else before they develop mesothelioma. But what we cannot find, what the UK government has not been able to find, is any medical evidence to say that young lungs are themselves more susceptible, not just an issue of the time sake.
So let's see, we have a few physicians in the room who may be able to help Dr. Black or Dr. Miller.
Well, you know, we've recently just looked at a group of childhood-only exposures in our population, and currently we have no evidence to suggest yet that there's any increased vulnerability of being exposed in childhood. It seemed like it would be to us, but of the ones we looked at, and that was what, how many did we get, Tracy? It was 200, wasn't it, we ended up looking at, yeah. So we were able to look at all those kids that grew up in Libby and left when prior to their, well, before their full lung maturation, basically, and then we brought them back, and they had no other exposures after they left Libby. And as far as their exposure to Libby amphibole, we did not see that they got that much worse disease. There are a lot of them with disease, don't get me wrong, but would it be any different than adults? We really don't see that prevalence like that, you know, that it would suggest that.
Very good question. Just statistically, if we look at the younger people exposure and then the expiration of latency periods, of course, if we take the young population and look at their, let's say, risk to get mesothelioma compared to the older exposed populations, we get the average age of onset of mesothelioma at the younger age than the population, let's say mixed population or older age cohort. So this is just a simple statistics, but I really don't have, I cannot recall a report telling then or showing that the young lung would be more vulnerable than the old one. I would be very prone to think just the opposite, because they don't have certainly so much smoking histories, and they don't have, in fact, mesothelioma is not smoke sensitive, but anyway, and they don't have, let's say, that much other exposures which may contribute in the lung tissue and pleural tissue for sensitivity or likelihood to get cancer. So I think at least this cohort effect is there, which is very, very well known in many other diseases as well.
Thank you.
And Sue, I have an answer to your question too, if you'd like. I'll read the Democrats that are co-sponsors on the S-697, which is the bill to reform the Toxic Substances Control Act, which is worse than current law. Tom Carper of Delaware, Joe Donnelly, Coons, Heinrich, Udall, Heitkamp, Warner, Brown, Manchin, and Stabenow. If you think about where the chemical companies are headquartered, sure, Carper of Delaware, Donnelly of Indiana, Coons, who I just have to be reminded of, I think that's Delaware too, Heinrich of New Mexico, Udall of New Mexico, and Udall is the Democratic lead. Warner of Virginia, Brown of Ohio, Manchin of West Virginia, and Stabenow of Michigan.
Named and shamed. Doug Larkin would like to ask Heather White a question. What's the likelihood percentage-wise that you think the Vitter-Udall bill may move and actually get to the floor and possibly pass? Is that right? Did I get that right?
That is a great question. I think we're looking at about 85%. I mean, this is, the chemical industry is really motivated to make this happen, and the reason is consumers have lost confidence in their products because of this issue of, every day a new chemical is showing up and polluting people's bodies and causing harm. So they really want to have an affirmative stamp of approval from EPA. They have a bipartisan deal. There's a lot of people who are up for re-election, and Congress is at a low all-time low when it comes to an approval rating. We really have to keep, the reason we're a nonpartisan organization, but we do need to try to keep a veto-proof majority is maybe where we're headed. And one of the things that we've said as an environmental health organization is that there's been a lot of attention on Keystone, but this is Keystone on steroids, because we're talking about people's health. We're talking about chemicals that are actually entering our body and staying in our body. And some of these chemicals stay in our bodies for generations. Like my great-great-grandchildren will most likely have some of these persistent bioaccumulative toxins in their bodies. So it's a really, really tough fight. But as we've seen today from the stories of everybody here, one person can make a difference. Everyone together can make a huge difference, and we really need to brace ourselves for a very big fight.
Yep. Thanks, Heather.
Another question?
Question?
I have a question from Mezab about you showed a list of all the heads of the different agencies and your president that are supporting an asbestos ban in Pakistan. Yeah. And we're nowhere near that in our country. So how did you do that?
After our first conference, we showed them that we are working on it and it's hazardous to health. So the president supported us and he wrote to us that it must be banned. And initially we have the parliament, we have the assemblies, we have the parliament. First we move the bill through a legal procedure way, like we will move the bill from the assembly, then to the parliament, then to the Senate, and then it will go to the president for its final signature.
So what is the likelihood that that will happen in the next year?
It will take 2 to 3 months for the legislation to be drafted, then we will submit it in the assembly.
Wow.
I have a question for the Brazil labor prosecutors. What you have is a very unique situation where you're able to go in with, where? Márcia? Márcia, can you respond to how unique your labor prosecutor's office is, and maybe you can help mentor some of the other countries, because you have the power and a lot of force, and you're very independent outside of your government, which we have Department of Labor, Department of Justice, but we don't have this independent force. And I think if we had something that was as powerful as what they have in Brazil, we might have a better response here, showing accountability. Can you respond?
Well, I think that the Labor Public Ministry, Labor Office from Brazil is a unique case in the world. We have administrative independence, we have budget, we have to follow the budgetary guidelines, yes, but we can propose for legislative our own accountability, and so it guarantees our independence in this way. Yeah, and the labor prosecutors don't receive any fees besides their wages. So I think that it's guarantees that we will follow our conscience, and we will sue these lawsuits when there is public interest. We will not act for any other interest, only when there is public interest involved.